I am about to show you why aggressively forcing your blood pressure down to the mythical 120/80 using standard pharmaceutical cocktails is actually starving your brain of oxygen, destroying the microscopic filtration units in your kidneys, and causing the exact ischemic strokes and terrifying cognitive decline the medical establishment claims to be preventing. I am going to show you how restoring shear vascular elasticity, shattering advanced glycation end products, and optimizing cellular hydration is the only biological way to fix this. We are dealing with a catastrophic systemic failure to understand the basic physics of human aging, and your delicate brain tissue is paying the ultimate price. Stay with me. For the next 30 minutes, we are going to completely dismantle everything your primary care doctor and your cardiologist have told you about what a normal blood pressure should be as you age. We are going to dive incredibly deep into the hardcore physics of cerebral perfusion pressure, the brutal mechanics of arterial resistance, the terrifying failure of the renal angiotensin system under chemical assault, and the biochemical reality of why your doctor's blind obsession with a single arbitrary number on a blood pressure cuff is putting your entire cardiovascular system in a dehydrating biological straitjacket. By the end of this masterclass, you will understand the exact physics of why a higher blood pressure is often a life-saving evolutionary adaptation, and you will have the aggressive, unyielding biological tools to achieve true, youthful vascular health. Comment below if your doctor has layered on a second, third, or fourth blood pressure medication just because your top number hit 145, leaving you dizzy, chronically exhausted, and terrified of falling every single time you stand up from a chair. Type perfusion if you want the exact, aggressive biological protocol to fix the mechanical root cause instead of suppressing the symptom and suffocating your cells. Let me tell you about Thomas. Thomas was 75 years old and was brought into my clinic by his deeply distressed wife. Over the previous 3 years, Thomas had transitioned from a sharp, active, retired structural engineer into a man who could barely remember how to operate his own television remote. He was stumbling, sleeping 14 hours a day, and his personality had flattened into a state of chronic depressive apathy. His primary care doctor and his neurologist had officially diagnosed him with early-stage Alzheimer's disease. They told his wife to get his affairs in order. But when I tore into Thomas's medical chart, the real monster emerged. Over the last 5 years, Thomas's doctor had aggressively layered on 3 different blood pressure medications: a high-dose thiazide diuretic, a powerful beta blocker, and an ACE inhibitor. Why? Because as Thomas aged, his systolic blood pressure naturally climbed to 150. His doctor, desperate to make Thomas's chart look like the chart of a 20-year-old, chemically bullied Thomas's blood pressure down to 112/70. The doctor was incredibly proud of this number. Here is the terrifying biological reality. Thomas did not have Alzheimer's disease. Thomas was suffering from chronic, profound, drug-induced cerebral hypoperfusion. His brain was literally suffocating in real time. As Thomas had aged, the arteries leading up to his brain had naturally lost their youthful elasticity. To push life-saving, highly oxygenated blood through those stiffer, narrower pipes up against the brutal force of gravity and into his skull, Thomas's heart had brilliantly and adaptively raised the pressure. That 150/90 wasn't a disease. It was a highly calibrated, intelligent survival mechanism. When his doctor chemically smashed that pressure down to 112, the blood no longer had the kinetic hydrostatic force to reach Thomas's frontal lobes and hippocampus. His brain cells were entering a state of complete cellular starvation. We instantly stripped Thomas off the dehydrating diuretics. We safely and methodically tapered the beta blockers that were putting a chemical vice grip on his heart. We implemented the hardcore elasticity and endothelial protocol I am about to teach you. We allowed his pressure to naturally settle exactly where his biological sensors demanded it, around 142/84. Within 6 weeks, the Alzheimer's vanished. His razor-sharp engineering mind returned. His balance was completely restored. The profound medical gaslighting he experienced from his previous doctors almost cost him his mind and his dignity. To understand the real truth about blood pressure in older adults and why the 120/80 standard is a dangerous myth for seniors, we must completely deconstruct the biomechanics of your vascular tree. We must begin with the physics of cerebral perfusion pressure. Your brain is the most metabolically demanding organ in your body. It sits inside a rigid, unyielding, bony vault, your skull. Because the skull is an enclosed box, there is a constant intracranial pressure pushing inward. To keep your brain tissue alive, your systemic arterial blood pressure must be powerful enough to overcome the resistance of your blood vessels. Fight the downward pull of gravity from your heart to your head and smash through that intracranial pressure. Think of your circulatory system like the plumbing infrastructure in a massive 80-story skyscraper. When the building is brand new, the pipes are highly elastic, wide open, and incredibly smooth. A moderate water pressure in the basement pump room, 120/80, is perfectly sufficient to drive water all the way up to the penthouse suite. But what happens after 60, 70, or 80 years of metabolic wear and tear, chronic systemic inflammation, and exposure to the standard American diet? Those vascular pipes undergo devastating structural alterations. This brings us to the first mechanical failure: advanced glycation end products, or AGs. When you consume processed carbohydrates and sugars, these glucose molecules float in your blood and aggressively bind to the structural proteins in your artery walls, specifically your collagen and elastin. This binding process cross-links the proteins. It literally caramelizes your arteries. The elastin, which is supposed to act like a rubber band, becomes stiff, rigid, and brittle. Simultaneously, you experience arterial calcification. Because of a chronic deficiency in specific fat-soluble vitamins, calcium precipitates out of your bloodstream and mortar cements itself into the medial layer of your arteries. Your pipes undergo a biological transformation from flexible rubber to rigid, unyielding concrete. If you use a pharmaceutical drug to chemically force the water pressure in the basement of that aging skyscraper down to the exact same level it was when the building was new, what happens? The penthouse goes completely dry. The water simply does not have the kinetic energy to make it up the rigid, narrowed pipes. In the human body, your penthouse is your brain. When you artificially lower blood pressure in a rigid vascular system, you create what are known as silent microischemic events. These are microscopic strokes. Areas of your brain's white matter literally die from a lack of oxygen. This tissue death shows up on an MRI as leukoariosis, which your doctor will casually dismiss as normal age-related changes. It is not normal. It is pharmaceutical suffocation. But the brain is only one part of this catastrophic equation. Let us look at your kidneys. Your kidneys are blood filtration factories. They contain millions of microscopic, incredibly delicate sieves called nephrons. For a nephron to filter the toxic waste out of your blood, it relies entirely on hydrostatic pressure. Blood enters the glomerulus, a microscopic knot of capillaries, through an afferent arteriole and exits through an efferent arteriole. Your body meticulously controls the pressure inside that knot to force the liquid waste out. When your doctor puts you on an ACE inhibitor or an angiotensin receptor blocker, an ARB, they are chemically paralyzing the efferent arteriole. They are forcing the exit pipe to dilate wildly. What happens to the pressure inside the filtration knot? It completely collapses. Your blood pressure drops on the cuff, making your doctor smile, but inside your kidneys, the biological filtration engine has stalled. Without that hydrostatic pressure, the toxic waste, the urea, and the heavy metabolites cannot be pushed out. They back up into your bloodstream. Your kidneys begin to mechanically choke on your own metabolic waste. This is why so many seniors on aggressive blood pressure protocols experience a sudden, terrifying drop in their glomerular filtration rate, or GFR. The doctor says your kidneys are failing due to age. No. They are failing because the doctor stole the water pressure required to run the machine. Next, we must expose the terrifying reality of baroreceptor adaptation. Embedded in the walls of your carotid arteries and your aortic arch are millions of microscopic mechanical stretch receptors called baroreceptors. These are the biological thermostats of your vascular system. They constantly measure the pressure and report back to your brainstem. If pressure drops, they signal your nervous system to constrict your blood vessels and speed up your heart rate. As your arteries stiffen with age, these baroreceptors physically stretch. Over time, they brilliantly adapt. They reset their baseline. They realize that to maintain optimal blood flow to the brain and kidneys through these stiffer pipes, the new normal cannot be 120/80. The new normal must be 140/90. Your neurological system actively sets the pressure there to keep you alive. When you introduce a beta blocker into this beautifully calibrated system, you are initiating a chemical lobotomy of your heart muscle. Beta blockers violently block the epinephrine and norepinephrine receptors on your heart. They act as a chemical vice grip, forcing the heart to beat slower and with significantly less contractile force. When you are lying down, this lowered output might be fine, but what happens when you stand up? Gravity instantly pulls your blood down into your lower extremities. Your baroreceptors scream in panic, firing rapid signals to your brain. Pressure is dropping, brain is starving, pump harder. But because of the beta blocker, your heart is chemically trapped in a straitjacket. It cannot respond to the neurological command. The blood pools in your legs. The oxygen drains from your brain. Your vision goes black, you become overwhelmingly dizzy, you lose your balance, and you crash to the floor, shattering your hip. This is called orthostatic hypotension, and it is a direct, violent result of treating a math equation while completely ignoring human physics. Finally, we must discuss the devastation of the endothelial glycocalyx caused by diuretic therapy. If your doctor prescribes a thiazide or loop diuretic, they are turning your circulatory system into a biological shop vac. These drugs force your kidneys to aggressively excrete sodium and water, sucking the fluid volume out of your blood. The blood pressure cuff reads a lower number because the pipes are less full. But what exactly is left behind? When you aggressively remove the water, you leave behind all the solid components, the red blood cells, the platelets, the heavy fibrinogen proteins. Your blood mathematically transforms from a smooth, flowing liquid into a highly concentrated, hyperviscous, abrasive sludge. It's like trying to force wet cement through microscopic glass tubes. This thick sludge creates massive, violent shear stress against the walls of your arteries. It physically scrapes away the endothelial glycocalyx. We have discussed this before. The glycocalyx is the lush, microscopic, hair-like forest that coats the inside of your blood vessels. It is your ultimate cellular bouncer. It contains the endothelial nitric oxide synthase enzymes that keep your vessels relaxed. When the diuretic-induced sludge clear-cuts this biological forest, your arteries lose their ability to produce nitric oxide. They lose their slippery, non-stick coating. Inflammation skyrockets. Macrophages rush in, burrow into the damaged arterial wall, and gorge themselves on oxidized cholesterol, creating massive foam cells and accelerating the very atherosclerotic plaque the doctor claims they are trying to prevent. You are trading a temporary drop in a symptom for the accelerated structural destruction of your cardiovascular system. So, what is the best blood pressure for older adults? The medical consensus is beginning to quietly panic because massive international studies are finally revealing that for seniors, especially those over 70 who have some degree of physical frailty or arterial stiffening, a systolic blood pressure of 135 to 150 is heavily associated with significantly better cognitive function, vastly lower rates of dementia, and a reduced risk of falls. The optimal blood pressure is the exact amount of hydrostatic pressure required to perfuse your end organs, your brain, your heart, and your kidneys without causing microvascular tearing. But our goal is never to simply accept a high pressure and do nothing. Our goal is not pharmaceutical suppression. Our goal is biological restoration. If your pressure is 150, your body is screaming that the pipes are rigid and the blood is sludge. We are going to aggressively attack the mechanical stiffness and the chemical viscosity, allowing your body to naturally and safely lower its own pressure because it no longer has to fight against a biological straitjacket. Here is the highly specific, deeply biological, unyielding masterclass protocol to fix the root mechanical causes of vascular resistance. Step 1. The glycation cleaver and matrix resuscitation. We must shatter the biological caramelization that has turned your elastin into rigid glass. You are going to deploy a massive dose of benfotiamine. Benfotiamine is a highly specialized fat-soluble form of vitamin B1. Unlike standard, cheap, water-soluble thiamine, benfotiamine aggressively penetrates the lipid bilayer of your cell membranes. Once inside, it violently upregulates an enzyme called transcatolase. This enzyme specifically hunts down and destroys advanced glycation end products. It literally breaks the sugar crosslinks out of the arterial medial layer, restoring the mechanical, rubber band flexibility to your large arteries. You must pair this with L-carnosine, a dipeptide that acts as a biological shield, preventing any new sugars from binding to your proteins. We are structurally de-aging the pipe. Step 2. The calcification eviction protocol. We have to extract the concrete from your arterial walls. No amount of vasodilation will work if your blood vessels are lined with calcium mortar. You must immediately stop taking isolated calcium supplements, which are actively fossilizing you. You must deploy vitamin K2, specifically in the MK7 form, at a minimum of 100 to 200 micrograms daily. Vitamin K2 is the biological traffic cop of the mineral world. It activates a specific protein in your vascular tissue called matrix GLA protein. When activated, MGP acts like a chemical scraper. It physically binds to the rogue calcium trapped in the soft tissue of your arteries and heart valves, pulls it into the bloodstream, and forcefully relocates it into the osteoblast matrix of your bones where it belongs. You must pair this K2 with a high-dose, fat-soluble vitamin D3, which provides the absorption mechanism, and magnesium taurate. The magnesium taurate is critical. The magnesium acts as a gentle, biological calcium channel blocker to stop the vascular spasms, while the taurine amino acid actively drives potassium into the cell to restore the electrical gradient. Step 3. The nitric oxide endothelial supercharger. We must replace the nitric oxide that your destroyed glycocalyx can no longer produce. Nitric oxide is the master signaling gas that tells your smooth muscle cells to relax and dilate. Do not take standard L-arginine supplements. As you age, your body produces high levels of an enzyme called arginase, which destroys L-arginine in the gut before it ever reaches your bloodstream. Instead, you must use a massive dose of L-citrulline combined with a highly concentrated, standardized beetroot extract. L-citrulline acts as a stealth bomber. It completely bypasses the arginase trap in your digestive system, enters the bloodstream, and is systematically converted into nitric oxide directly inside the endothelial cells of your blood vessels. The beetroot extract provides dietary nitrates, which trigger an alternative, completely separate backup pathway for nitric oxide generation. This combination creates an explosive, sustained biological pressure release valve, opening the rigid pipes without the dehydrating shock of a pharmaceutical drug. Step 4. The osmotic intracellular hydration flush. We must completely reverse the toxic, abrasive blood sludge created by your low-salt diet and diuretics. Your cells are locked in a state of severe cellular starvation. You must repair the microscopic sodium-potassium pumps on the surface of your trillions of cells. Throw away the dead, bleached, processed table salt. You must obtain unrefined, hand-harvested Celtic sea salt or Redmond real salt. These contain over 80 crucial trace minerals, including naturally occurring magnesium and chloride. Every single morning, you must take a heavy pinch of this wet salt, place it directly on your tongue, and let it dissolve into your mucosal membranes before drinking a large glass of filtered water. Why on the tongue? Because it instantly triggers the neurological osmoreceptors in your brain, signaling your cells to open their aquaporin channels. The water does not just flush blindly through your kidneys. The trace minerals create an intense electrical gradient that forcefully pulls the water directly into the vascular compartment. You are physically thinning the thick, abrasive sludge back into a smooth, life-giving liquid, completely stopping the violent shear stress against your artery walls. Step 5. The mechanical fascial pump. Your cardiovascular system is not isolated. Every vein and artery is woven into a dense, full-body web of connective tissue called fascia. Decades of sitting, poor posture, and shallow breathing cause this fascia to shrink wrap around your blood vessels. It creates a mechanical tourniquet. No chemical or supplement can fix a purely mechanical restriction. You must manually break the fascial crosslinks. You are going to activate your second heart, the massive soleus muscles deep inside your calves. Every 2 hours during the day, you must perform 3 minutes of aggressive, explosive calf raises. You violently contract the muscle, physically squeezing the deep veins and forcefully shooting the pooled, stagnant venous blood upward against gravity. This massive mechanical siphoning breaks the fascial straitjacket, clears out the acidic metabolic waste pooling in your lower extremities, and massively drops the peripheral resistance that your heart has been struggling to pump against all day long. The medical establishment has turned the brilliant, adaptive survival mechanisms of your aging body into a multi-billion-dollar disease model. They are treating a number on a piece of paper while actively destroying the biological engines that keep your brain sharp, your kidneys filtering, and your heart pumping. You are not a broken machine. You are an infinitely complex biological ecosystem that is desperately fighting to survive the chemical starvation and mechanical restrictions forced upon it by bad advice. It is time to stop blindly accepting the chemical lobotomies and the biological shop vacs. It is time to shatter the advanced glycation. It is time to extract the concrete from your arteries. It is time to restore the electrical hydration of your cells and release the mechanical straitjacket. Give your brain the massive tsunami of oxygenated blood it is screaming for. I'm Dr. Amelia Carter. I'll see you in the next video.